And so what I'm going to discuss is some of the work that we did with Dr. Renz a handful of years ago. And the first disclaimer I want to give is that I actually wasn't a part of this work. This occurred before I joined Weighing In, but I've just spent a lot of time over the past couple of years really kind of trying to understand what this information tells us. And Dr. Renz's last slide was really important. The first thing on the top of his bullet was, the first thing you have to do is to focus on the current reality. And I think that that's kind of what the goal was with this mapping project that was conducted. So I'm a part of a group called Weighing In. Weighing In is a program that is currently housed at Children's Mercy. It's a coalition of community groups that are working in the area of childhood obesity. And so hopefully you're all members of Weighing In. If not, we'll post that information of how you can join our coalition and how you can get on our mailing list and things like that later on today. But what I've been particularly interested in since I've joined Weighing In is this idea of preventing and treating childhood obesity as a system. And so this is far from a new idea, and it's far from an original idea. You know, this is from an article almost 10 years ago that the essential elements of developing a multi-level agenda is to frame obesity as a complex systems problem. And if you think about obesity as a complex systems problem, only then can you really develop effective programs for the prevention and treatment of childhood obesity. And so, you know, I think the goals of the systems mapping project were kind of twofold: to create, you know, kind of a regional database of all the programs related to childhood obesity in the Kansas City area, and then use that information to support future efforts to deal with childhood obesity as a system. And so the result of this work, well, let me just take a step back. And so you've seen this once already. I can't remember, I think it was Dr. Renz showed this, or maybe Dr. Salas, but you see it quite a bit. This is essentially the systems map of obesity and energy balance. And so most people think of energy balance as calories in and calories out. And that is true. That's the first law of thermodynamics. But it's also a very simplistic way of looking at energy balance and obesity. And so I think of energy in, energy out as at the center right there. But as you can see, there's a whole host of other factors that ultimately influence energy balance and obesity. So for example, you've got physiology. So do you have a high metabolism, a low metabolism? Do you have a health condition like diabetes or some other medical condition that might predispose you for weight gain? What type of foods are you eating in terms of consumption and how that food is produced? Psychology is obviously plays a huge role in energy balance and obesity, both from a social perspective and an individual perspective. My training is in physical activity, and so I spend a lot of time over here. And that's not only the individual physical activity that a person is performing, but also the environment that people are doing that activity in. And so if we zoom in to that part of the systems map, you can see a whole mix of factors that are ultimately playing a role in physical activity and thus energy balance. And so, for example, we've got right down here your fitness level. That is physiology, that is somewhat genetically based. There is over here, that is related to appetite control. Here is your individual levels of physical activity in different domains. So how much physical activity you do to get from one place to another, how much physical activity do you do in your job, around your house. Do you care for lots of children? Are you a single person? Do you participate in recreational physical activity? So those are all things that we tend to think of at the individual level, but as you can see, there's lots of arrows that lead to these individual factors. So what do we have over here? We've got labor-saving devices. The opportunities to do physical exercise can influence your recreational physical activity. What type of transportation do you use? Is it safe to use unmotorized transportation where you live? Or do you have to drive a car everywhere? So as you can see, not only are there multiple factors that influence energy balance, there are multiple factors that influence physical activity. Some of those are related to biology, some of those are related to the built environment and the environment that we live in. And so that's why the work that Dr. Salas has done has really kind of helped us understand how we can act on all of these levels. So this is the ecological model that Dr. Salas created several years ago. This is one of those diagrams that as a graduate student, when I first saw this, I said, oh, this makes sense. This is exactly how we can intervene and change behavior. And we have, Dr. Salas did a nice job presenting on it. We have co-opted it for this summit, and you're going to see a version of that, our version of that, several times today. You've actually seen it already a couple times. This will probably pop up in most of the presentations that you're going to see over the next couple days. And the purpose of it is to really identify work that people are doing and which levels they're operating on when they do this type of work. And the information that I'm going to present today, as Dr. Renz kind of alluded to, is organized in just a slight variation on this, where normally where we have policy on the top, individual at the bottom of the graph, we're also organizing things by formal structures on top, the social and physical environment in the middle, and transmission of behaviors and practices down towards the bottom of the slide. But they are very closely related to the levels that you see along this white arrow. And so this is how I'm going to present some of the information that was collected in the Kansas City region in relation to childhood obesity systems. And so this work occurred in 2012 and 2013, and it started out with an advisory group working with the Midwest Center for Nonprofit Leadership. We organized all organizations that are working in the field or in the area of childhood obesity, and then queried them on very key factors of not only the organization, but the type of work that we're doing. Let's see. And I guess I should note, the end result was a couple things. The first is this document. It's about a 40-page document. It is available for download on the Weighing In website that's housed at Children's Mercy. The easiest way to find it is to Google Weighing In Children's Mercy, and then you can find this presentation on that website. If you have any trouble with it, feel free to just send me an email, and I'm happy to send you the PDF. Additionally, we have a very extensive database with all of this information in it. And that is not posted online because it's a little bit hard to navigate. But if you are an organization and you're working in on the, let's say the transmission of behaviors and practices in your organization, but you want to expand and you want to partner with someone who's doing policy work, you can reach out to us and we can give you a list of all the organizations in the Kansas City area that are doing this type of work. And that's kind of how we intend this database to be used. So what did we learn? We identified 100 organizations that are working in some way related to childhood obesity. And so I italicized and underlined the word organizations because we're also going to be presenting on programs. So this is organization, 100 organizations working in the field of childhood obesity. Here's some information on their budget. No surprise, budget is directly related to the geographic scope of the work that they're doing. So within those 100 organizations, about 60% are nonprofit organizations, but 37% are governmental organizations, and 5% are for-profit organizations. Of those 100 organizations, we identified 260 programs that were going on within the organizations. And in terms of the target populations that these programs were working with, you can see the largest number were focused on school-age children, with the second being professionals. And so what this means is professionals who are interacting with children, their parents. That might be a teacher, that might be a school wellness officer. That would fall under the professional category. 9% are working with infants, 16% for early childhood, and there are also a good chunk of organizations working on mothers and their families. These programs were administered in a wide variety of different locations. Starting with the least number of locations, we have hospital, home, there's some online. The most common location for these programs was by far in a school setting. Now, as you can see, there's going to be a lot of data presented over the next few slides, and it can be a little hard to keep it all straight. And so what I've tried to do to understand this information is I focus on the locations where I currently work. And so that's at a hospital or a healthcare facility. And I see how that compares to other locations and other settings. And so hospitals and healthcare facilities are towards the bottom of the list in terms of the amount of programs that are related to childhood obesity. So to me, that's an early sign that we could potentially be doing more as a healthcare institution. In terms, getting back to the population that they serve, most programs focus on clients who are low income. There's almost an equal number in most target populations that are focused on low income as well as all incomes. We've seen some data from Dr. Salas that indicates that income may play a role in obesity rates, so it's good that we're seeing some specific programs specifically focused to the specific needs of low-income clients. When we look by race and ethnicity, we see something quite different. There are very few organizations that specifically focus on a particular racial or ethnic group. Most focus on all individuals, regardless of their race or ethnicity. So you can look at it in a couple of different ways, I think. Most of the work is being done by governmental and nonprofit institutions. And so governmental institutions, programs offered by governmental institutions are in the orange. Gray is nonprofit. As you can see, they represent the bulk of the programs that exist. What's striking to me is that there is a very small number that are truly collaborative in nature. 9 for professionals. When we look at school-age children, only 12 programs out of about 160, 170 are truly collaborative in nature. Now, no doubt that some of these programs offered by the government or the nonprofits partner with organizations, but they are not co-equal administrators of a program. They may just borrow literature from one sector versus the other, or may have them serve on an advisory board or something like that. But there are very few that are truly collaborative in nature. This is alarming when we've heard lots of evidence that to address childhood obesity, we need to think of things on multiple levels. There is a large variety in the mission focus of the groups that are doing this type of work. So we see a lot of childhood education programs, so this is school-based programs. But we do see a lot of other programs that are focused on youth development, so this might be YMCA programs. We see a lot related to recreation and sports. I'm actually surprised that this isn't a little bit higher given the prominent role that sports play in our youth physical activity. Again, when we look at the healthcare, it's towards the tail end of the number of programs. Again, when we look at where the programs are being administered and the target population, we see generally a nice mix. Obviously, with school-based programs, they're largely targeting school-age children. But this seems to me like an excellent opportunity to expand the scope of these programs that are targeting just the kids, to include their parents, their families, the professionals that work with them. To me, this is a way that we can use this information to identify where programs are not being administered. Again, healthcare towards the bottom of the list. I'm going to skip over this one for time and get back to kind of what I think is the meat of some of this data. And so if we return to our ecological model, where we've got policy and formal structures on top and individual and behaviors and practices on the bottom, we would generally expect the number of programs to be largest at the bottom of this in terms of individuals and transmission of behaviors and practice, because it takes a lot of resources to deal with individuals on a one-on-one basis. It takes a lot of manpower, it takes a lot of time, it takes a lot of programs. Whereas policy work takes a lot of work, but there might be fewer organizations doing that type of work. What we found actually was that there were the most number of programs doing work related to the physical environment. This, I think, is a real strength of the Kansas City system, is that there are so many programs devoted on changing the social and physical environment. When we look at how they're broken down, the formal structures, social and physical environment, and behavior and practice, you see the colors here relate to starting with the bottom. So systems monitoring more often occurs in formal structures, so putting policies in place. Likewise, funding most often occurs in groups working in formal structures. Whereas when you were looking at transmission of behaviors and practices, you see lots more programs devoted to consumer education and communication and information. So in general, I think the distribution of the types of programs based on their level of the ecological model is appropriate, but we have a large number of groups doing work related to the physical and social environment. It's a real strength of the Kansas City system. And so what are some of our lessons that we've learned? One thing that we didn't really grasp with this analysis is we don't know the influence of one program. All programs are created equally in our current analysis. One thing that's often missed when we look at systems map is that these arrows are of different thicknesses, and the level of the thickness is equated to its control on the system. So as you can see, there are some things that have a very large influence on a system, much more than others, and we did not evaluate in this analysis, so we can't comment on that. We also did not do a very good job of measuring the connectedness of the system because it's very difficult to do. So we don't know exactly the amount of communication that is occurring between the different levels and between different programs. One thing that we have noticed is that there's, in general, as we've shared this information, a lack of understanding by funders in particular of exactly how systems work. And funders often talk about how important multi-level approaches are, but there's no evidence that they are actually evaluating that or requiring that in the types of applications that they fund. And I think that this is a crucial step that is needed in the Kansas City area. We try to use this information to guide our coalition. And so we found and this is language straight from the document, is that there are programs at every level of the system, every element of the ecosystem, and serve every function that a system typically requires. And as a result, we think that the region is actually very fortunate, and we are really primed to make real action in childhood obesity. However, there's opportunity to strengthen the linkages between organizations and to better integrate their work. And so we need to make sure that advocacy groups are maximizing their individual roles to maximize the collective impact. And that's where we need organizations that can serve as backbone organizations. And so Weighing In would like to think of itself as one of those organizations. There are other great organizations that in Kansas City that focus in childhood obesity and specifically specific areas of childhood obesity. So maybe early childhood work. There are certainly some great organizations that can serve as a connector between multiple programs doing the same work. There are an abundance of education programs, which is not uncommon. I didn't present this information, but the bulk of those are related to nutrition. And so this represents a real opportunity for physical activity programs to be developed. And that's certainly one of the things that we're trying to do at Weighing In. And there was a clear lack of focus on racial and ethnic groups. There are a lot of programs focused on specific income groups, but we're not seeing that with specific racial and ethnic groups. So we can definitely say that more collaboration is needed to help really kind of leverage the collective work of the organizations in Kansas City. And so the last thing I'll state is that again, we identified 260 programs working in childhood obesity across 100 organizations in Kansas City. Less than 10% involve truly collaborative efforts. I look at things from a healthcare perspective. There are 6,100 physicians and 28 hospitals just in Kansas City. In terms of early childhood, there are 650 early childhood learning centers, 1,700 care programs, and they see 60,000 children each year. There are almost 1,800 public and private schools operating just in Kansas City. These are prime opportunities for programs to be collectively working in these areas, specifically to overcome these gaps, for example, like we see in healthcare. And so I really like this quote: a systems-oriented, multi-level framework, encompassing all sectors, is really the only way to generate solutions to deal with a complex issue like childhood obesity. So with that, I should have thanked these people earlier. Again, this work was done a lot of this work was done prior to my joining Weighing In, and so we definitely want to thank Deb Markinson, Emily DeWitt, Shelley Summer, and Emily Meisen-Sebelius. We've worked a lot with collecting or analyzing some of this data with a graduate student named Francis Bostic and Jordan Carlston, and of course thanks to Dr. Renz and his group at the Midwest Center. So with that, we are running just a little bit behind schedule. And so what I'm going to do right now is, thank you, active applause, please.